Hey everybody, welcome to a new video. In this case, we will be treating a patient with a quite small cavity on his lower right molar on the buccal side. I hope you enjoy the video, and if you do, please leave a like and subscribe for more. Thanks. So how we started this case is first by applying a local anesthesia, and even though a local anesthesia is never necessary, in my opinion, it is more comfortable for a patient if we apply the local anesthesia because they don't have to wait on any pain they can feel during the treatment. After administering local anesthesia, we place a rubber dam, which you can see as the blue background in the video. And the rubber dam is essential not only for providing a clear view throughout the treatment, but also for keeping the area clean and dry. To start the treatment, I removed the decay in the cavity using a cylindrical diamond burr with water cooling. This helps to clear out most of the excess material and any affected enamel. Once the majority is removed, I switch to a carbide round burr. And this is more suited for removing infected dentin, the softer tissue beneath the enamel. After most of the decay is cleared out with the burr, I check the underlying dentin with an explorer to ensure it feels hard. If it does, I then smooth out any sharp edges with the cylindrical burr once again. And rounding these enamel edges allow for a better adhesion of the filling to the tooth. Once the enamel is prepped, or beveled as we say, for better bonding with the filling, we etch the enamel with a blue gel containing phosphoric acid. This etch has to be applied for at least 20 seconds, and the goal is to etch only the enamel and not the underlying dentin, although this can be tricky sometimes to perform perfectly. After the etching, we rinse it off thoroughly with water and then dry the area carefully, as moisture can prevent the filling from bonding properly. And then after the drying, we apply a primer and a bonding. The bonding layer acts as an adhesive layer between the filling and the tooth. And as you can see, after applying the bonding, we cure it with a UV light to activate the bonding. And then it's time to apply the first layer of composite. As you can see, I start by applying a very thin layer of flowable composite. That's more a fluid type of composite. And on top of that, I immediately apply a much stronger type of composite, known as a posterior composite. This type is more resistant to chewing forces, and after applying, we use various instruments to shape the composite. This sculpting can take some time. As you can see, I am taking some time for it because the more you sculpt the soft composite, the less you have to shave it down after the filling is hardened. And this shaving down and polishing the hardened composite usually takes more time than sculpting the soft material. We will cure the first layer of composite with the UV light, and that makes the soft composite immediately very hard. And in this case, I applied a second layer of composite only with the softer and more fluid type flowable composite. And this is also shaped with the different instruments. After this final layer is in place, we use the UV curing light one more time to make sure the filling is fully hardened. And this final curing step is crucial to ensure that the filling is durable enough to last, hopefully, for the next 15 or 20 years. The composite material needs to be at least as hard as the dentin and ideally as hard as the enamel. And once the last layer is cured, we finish the filling by polishing it with special different burrs. And in this case, I only used a Soflex disc and a polishing burr. And with that, we reached the end of this video. I hope you enjoyed it. And if you did, please give it a thumbs up. And if you have any tips or feedback on improving these videos, please let me know in the comments. I read them all and I appreciate it very much. So let me know what you think, and I hope to see you in the next video. Thank you, bye.